and I am here from City Match. City Match is a national maternal and child health organization, and I will be sharing my own slides today. So just one second as I pull those up. Thank you all for joining us. It's a pleasure to be here with you. I have a bit to discuss, but I'm going to kind of fly through it because I know we have a lot of panelists today. So the slides are there, and I'll share it with Camille after this. But just so you know, I'll be flying through it a little. I just want to let you know that I am on the indigenous land of the Omaha people, the Omaha tribe. If you are unsure whose land you are on, I recommend going and finding out. The link there at the bottom of the slideshow will tell you. First off, I just want to start talking about settling us in the social determinants of health. We all are really familiar with this. The Department of Health and Human Services outlines these 5 buckets: education access and quality, healthcare access and quality, economic stability, social and community context, and will be centered in neighborhood and built environment. Though I will say, as I talk through this, we will kind of touch some of the other social determinants as well. Today, we're really centered in housing, and we know that the access to safe, affordable, and stable housing has a direct correlation and direct impact on physical and mental health of individuals throughout their life course. All right, and so what I mean by safe, affordable, and secure, those words are very intentional. Safe environment, that is the built environment around them. So that would be like safety from environmental toxins such as lead or air pollution, but also safety in their environment as well, around crime prevention, things of that nature. And then what I mean by affordable is making sure that housing isn't a burden on people. So it is less than 30% of their overall household outcome or income rather, and that'll come up again. Folks should be able to buy food and other housing things outside of their rent or mortgage, and it shouldn't be so burdensome. And so that's what we mean by affordable. And then also secure, meaning that it is safe, stable, and secure, like there's no risk of eviction or any types of risk of losing their housing and becoming homeless. Those are really important things when we're thinking about adequate housing. It needs to cover all of that. I'm putting up this quick slide of Maslow's hierarchy of needs. This was created by Abraham Maslow in the early 1940s, and it's gone through several different iterations, but I really want to point your focus at that foundational physiological needs. You'll see air, water, food, shelter. And I really want to point out that shelter and housing is foundational to our needs in order to reach a point of self-actualization. And so when we're thinking about what people just need to live to thrive, because we want people to thrive, we want them to get past surviving to thriving, housing is one of those foundational pieces that must be there. So housing is one of the key components when we're talking social determinants of health. And it's important in thinking about health outcomes overall. So things such as cardiovascular health, infant mortality, or overall birth outcomes such as infant mortality, prematurity, maternal mortality. We'll talk a bit more about that in just a second. Specifically, housing instability has been linked to poor physical and mental health, and that is defined as, the housing instability is defined as the high housing costs that we touched on previously, poor housing quality. So that quality of housing is very important. Unstable neighborhoods, overcrowding, which might be necessary if someone can't afford to live in a unit by themselves. There might be multiple families living in a single house or a single unit. And that can lead to issues such as safe sleep that we see when we look at maternal and infant health outcomes, but also just homelessness. So not having a home or place to lay your head at night at the end of the night, homelessness is a big issue. Housing tenure really speaks to how you're paying for your housing. So whether you have a mortgage, you pay rent, or you're on subsidized housing, those specific components actually can lead to differences in our health outcomes. So those with the mortgage tend to have better health outcomes than people that are renters or are on subsidized housing. So the one thing that I'm going to focus on in my part, there are several policies that have impacted access to housing. And I just want to point out, I will be focused on one specific policy, but when we're talking about some of these policies that have impacted housing, they are rooted in racism. And so I'll be talking about redlining today, but there are several other policies within the New Deal of the 30s and 40s. I recommend, if you don't know a whole bunch about that, to look it up. I recommend reading The Color of Law by Richard Rothstein if you haven't, because I'll just be touching on some of this briefly. And I'll be focused there. But there are a lot of policies around like the GI Bill, policies around urban renewal that have led to these disparities in health outcomes that we see centered and focused around housing. But for today, I'll be talking about redlining. And if you aren't familiar with redlining, it is a discriminatory practice that has been done and honestly sometimes is still being done, where banks or mortgage lenders are denying access to their services, so it could be insurance companies as well, in certain communities. And in the early 30s, the Homeowners Loan Corporation kind of created this type of language of having under desirable or least desirable spaces. And so they literally took a map and drew red lines around places where they would not actually loan people for home ownership in the area. So this was institutionalized by the US Housing Act of 1937. But this really resulted in a huge downturn in communities. There were communities of color, specifically Black communities, who were thriving, had wonderful wealth opportunity, businesses, things of that nature. And then when redlining was instituted, it took away the ability to own homes. It made renting actually much more expensive than home ownership. Also led to a downturn in employment because businesses didn't want to be in these undesirable areas, and so they ended up moving out. So if you are living in a place where there aren't businesses where you can be employed, then that then has an impact on the community overall, but also your health when you think about potential stressors. So when we think about the connection to health outcomes, inadequate housing has been directly linked to rates of poverty and inability for upward mobility. There was a recent equity report released by HRSA, and in that they found that adults with the housing burden, so that housing burden, remember, is more than 30% of your household income is going towards your rent, mortgage payment, anything of that nature. Adults with a housing burden are more than 3 times more likely to experience worsening health. And then compared to homeowners, renters, and especially those on subsidized housing, has significantly higher risk of heart disease, diabetes, hypertension, things of that nature. And a recent study that was just released last year actually found a significant association between housing insecurity during pregnancy and adverse health outcomes. And so there have been several studies over the past couple of decades, I would say, that have done some research. If you don't know about Arlene Geronimus, she has done several studies correlating the perceived racism to the shortening of telomeres. So we're talking about biological, physiological impact on folks' bodies. So if people are experiencing housing instability and that leads to stress that stays kind of pent up in their bodies, which we call toxic stress, because it's normal to have stress, but when your stress levels don't go down and they stay high, that can lead to toxic stress. That can lead to the deterioration of your telomeres. Deterioration of telomeres is normal over a lifetime, but the premature deterioration can lead to adverse health outcomes that we're seeing. It has been directly linked to adverse birth outcomes, such as prematurity, low birth weight, infant mortality, and maternal mortality as well. So I'm just going to show you a couple of maps and then I will wrap it up just to put some real contextualization to this. This is a redlining map of Akron. And I found all of these through the OSU Library's website. And this is, if you all are familiar with Akron, this is the area. And I want to put another map side by side. This is a map that was released by the Summit County Public Health Department around their infant mortality rates. If you just look at where some of the infant mortality rates are really high. Oh, and just so you know, I'm sorry I didn't explain this, the redlining map, those areas that are outlined in red are the least desirable or 4th grade. If you look at the legend, it's really small to see. And then it is followed by the yellow level, which is the next tier up. the blue, and then the green is the highest grade, grade 1, or the most desirable area. But if we look at this map from looking at infant mortality rates and we overlaid that with the Akron redlining map, there's just a high correlation there. You can just see visually. Similarly, this is a redlining map of Columbus. And so I was able to pull some data from the Columbus City website. And I think this actually this information was also from Celebrate One. But the 2016-2018 sleep-related infant deaths in Columbus, if you look at that and you overlay it with Columbus's redlining map, you see a direct correlation there with the shape as well. So I put those two maps up just to show us health doesn't happen in a vacuum. We often say that at City Match. It happens, health is impacted by so many things. And so we can't disconnect what has happened historically with what the health outcomes that we're seeing today. And so I just want to lay you in that foundation as the local teams go on to explain what they are seeing and some of their programming that they are doing. Thank you all so much. That's references. Like I said, I'll share this just because there's just a lot of information you might want to have. And here's my contact information. Thank you so much.
Thank you for presenting. That was a lot of really great information. And again, sorry about the mispronunciation. Okay, we will turn it over to Jill. You're going to share your screen, correct? And I'll let you take it away.
Okay. Good afternoon, everyone. My name is Jill Spillman. I am the Educational Initiatives Supervisor here at the Akron Metropolitan Housing Authority. I'm going to start off by giving you an overview of AMHA, and then I'm going to tell you a little bit more about what we're doing here at AMHA to help bring down our infant vitality numbers. Joining me today is Shalita Smith from the Summit County Public Health Department, who partners with the City of Akron to oversee our county's infant vitality work. AMHA is located in Northeast Ohio, and we serve the entire county of Summit. Our public housing portfolio consists of over 4,000 rental units at 26 properties, made up of multi-family apartments, townhomes, high rises, and scattered site single-family homes. Our local housing portfolio consists of over 800 rental units at 9 different properties, also with multi-family apartments, single-family homes, a mid-rise, and a high-rise. And our Housing Choice Voucher program serves over 10,000 individuals. We're currently at 98% capacity with over 20,000 families on our wait list. So housing is a great need here in Akron. And Shalita will get into that a little bit more when her slides come up. I'll go to the next slide. This slide shows a basic breakdown of the individuals that we serve. You'll see there's public housing, then Housing Choice Voucher, and then our local housing authority. The majority of our households are headed by females and have an average annual income under $12,900. In total, we serve over 21,000 individuals, and over 3,000 of them are under the age of 5. This is approximately 10% of the total children under age 5 that live in Summit County that we have access to. This fact, along with the creation of a county initiative focusing on prenatal to kindergarten called First Things First, led to the creation of AMHA's Early Childhood Initiative in 2007. Okay, so AMHA's Early Childhood Initiative's main role is to connect with and empower families to ensure that they become their child's first and most important teacher. The initiative consists of 2 home visitation programs, Parents as Teachers and Spark Ohio. Parents as Teachers is a national evidence-based home visitation program that primarily serves children ages prenatal to age 3. And the Spark Ohio program provides a kindergarten readiness advantage for families with preschool age children ages 3 and 4 up until kindergarten. Both of these programs provide developmental screenings, referrals to needed resources to assure that families and children's needs are met as early as possible. When it comes to our infant vitality work, we really are focusing on the Parents Teachers program, and we are a Blue Ribbon model affiliate. Our affiliation with Parents Teachers began in 2010. We hit fidelity in 2015. I believe this was our fifth year in a row that we met all of our essential requirements. With Parents as Teachers, we are able to enroll a family prenatally. Parents as Teachers is shown to increase healthy pregnancies and improve birth outcomes and improve child health and development. In typical non-COVID times, our child and family partners go into the family's homes at least once a month to complete curriculum activities, set and work towards goals, and address the health and well-being of the family. But due to the pandemic, we've primarily been working virtually over the past year and allowing some outdoor visits as long as we can do them safely, maintaining distance, wearing masks, which can be a challenge when you're working with little ones that really want to go give their home visitor a hug. Other examples of our infant vitality work are in partnership with other service providers in the county and the state. We partner with Akron Children's Hospital in their Cribs for Kids program. And this gives us access to free portable cribs that we can provide to our families if the family doesn't have anywhere safe for their infant to sleep. In order to receive the cribette, the families must participate in safe sleep education and complete required paperwork. Each of our home visitors are trained in safe sleep and teach our families the ABCs of safe sleep, which are alone, on the back, and in a crib. Sharing the message is really important throughout our agency. We like to make sure that everybody knows this. It's not just us that work with the kiddos, everybody needs to know, including reminding families that they need to tell their parents and the babysitter. Spread the word, ABCs. And if they don't have that C, the cribette, we will get it for them. We also partner with Project MKC to fill a critical unmet need of diapers. We are eligible to receive up to 6,000 diapers each quarter. Diapers are expensive, as most of us know. They cost an average of $75 a month, or roughly $900 a year for just one child. Excuse me. According to the National Diaper Bank Network, about 1 in 3 families nationally do not have enough diapers to keep an infant or child clean, dry, and healthy. We're able to provide a little bit of stress relief for our families by providing up to 2 packs of diapers and wipes to each child each month. We provide these diapers to families that reach out to us for assistance, and we also regularly offer them to our home visitation participants as kind of an added bonus to being active in our program. Both the Cribs for Kids program and Diaper Bank provide us with the opportunity to partner internally with AMHA property managers, inspectors, pretty much anybody, maintenance, office staff. Everybody who comes into contact with a family can help us find out if the family needs either a safe sleep environment or some diapers. And they can, share the name with us. We'll reach out to them, we'll give them what they need, and then we're going to try to engage them in programming. We also know that a mother's depression can impact the health outcomes of her newborn. We partner with one of our local behavioral health agencies, Child Guidance and Family Solutions, to offer maternal depression support groups on site at 6 of our AMHA family development community rooms. These groups have been meeting virtually over the past year, but we do plan to get back in person as soon as it's deemed safe in our area. While these groups are non-clinical, they provide a safe space for our moms to come together and talk about the joys and the woes of parenting. They do have access to a licensed facilitator who uses an evidence-based curriculum called Mothers and Babies that kind of guides the conversations. Funding. AMHA is not a moving to work community. And HUD does not provide any early childhood funding. So funding for our programming is raised through AMHA's nonprofit subsidiary, Building for Tomorrow. Building for Tomorrow works with AMHA Resident Services to provide specialized wraparound services for our residents with 5 priority areas, which are early childhood education, financial self-sufficiency, community building, digital inclusion, and health and wellness. The majority of our early childhood funds come from our local community foundations that have made a commitment to early childhood in our county and especially in the city of Akron. This program wouldn't be where it is today if it was not for the United Way of Summit in Medina County, the DAR Foundation, and the Akron Community Foundation, who have supported AMHA not only financially, but have also given us endless guidance and support that have allowed us to continue to grow so that we're able to continue to serve more and more families. We've also just recently added some state dollars. So we are in the process of becoming an Ohio Help Me Grow home visiting provider. And we do get some funding from the Ohio Children's Trust Fund. So we're really working on getting a little bit of diversity in our funding to kind of even things out. Let's see. Okay, I think this is Shalita. You want to take on?
Thank you, Jill. Good afternoon, everyone. As indicated before, my name is Shalita Smith, and I am the manager of maternal child health here at our health department in Summit County. Today, I have the pleasure of representing Full Term First Birthday, which is our collective impact collaborative. And I have the pleasure of serving as the co-chair of that organization within my role. So today I'm going to talk to you a little about my role as the co-chair as well as my role as manager of maternal child health. So this slide gives you our mission statement as well as our priority focuses for 2021. And I just want to give a little bit of backstory of how this even started. So in 2012-2013, the state of Ohio deemed 9 counties as having vast inequities in poor birth outcomes and infant mortality. And these counties were named as the Ohio Equity Institute. And as a collaborative, we have been working to decrease the disparity in our infant mortality rates across the state. So in 2017, the city of Akron's mayor worked with a lot of partners in our community to develop a collaborative similar to Celebrate One, which is going to speak after us. And it's just been so great to work with so many partners in our community. There's over 40 partners in our collaborative, focusing on various high-level social service agencies to grassroots agencies, to churches, and to political leaders. So it's just a great grouping of individuals. In 2021 specifically, we've been very, very focused on housing. Obviously, that's why we're here, as well as safe sleep and racism and implicit bias. Next slide, please. So as far as AMHA and Full Term First Birthday, together we have participated in strategic planning, working on focus groups and work groups, really trying to get the community involved in our engagement and all of our different practices and policies and program implementation that's happening across the community. We have monthly calls, and within those monthly calls, we talk about current strengths, weaknesses, and varying challenges that we have, as well as being creative in our initiatives moving forward. We have been having annual baby showers for a very, very, very long time now, but since COVID, we've really changed our practices, and last year we implemented 2 drive-through showers, which were absolutely amazing. We served over 470 women. And it was a really unique because it was just an opportunity for a lot of our community partners to participate in something that they've never got to participate in before, because the amount of volunteers that we had to have, we had over 40 volunteers to do such a large event, but it was really great. And just the outpour of support from the community was just remarkable. As well as policy change. So AMHA has been very influential in all of the policy changes that have come and will come. And one of the things that I'll talk about a little bit later is our preference point pilot program that we're going to be doing with AMHA, which will hopefully be starting within the next week or so. And this is just going to enhance the need of getting pregnant women to the top of the waiting list for housing. Next slide, please. So today I'm going to talk a little bit specifically about Summit State of Housing. This was touched a little bit by Jessica when we're talking about redlining as far as Jill. But Summit County has some of the highest eviction rates in the United States and the highest in the state of Ohio. So we've really been keening and focusing on that. This information is from Eviction. If you go to Eviction Lab, it's a great website. It's really influential. The information is it's just amazing what you can see on there. But unstable housing really comes from a lot of the things that have already been indicated. The trouble paying rent. We're seeing a lot of instability in terms of medical care, as well as just being transient during this time. And then this overall inability to have stable housing just dramatically affects your housing and your health as a whole. So as you can see in the graph, you can see that the Akron rates are dramatically higher than the state, as well as Summit County as a whole and the United States. So we obviously have some work to do as far as eviction rates. And then the next slide is going to give you even some more shocking information. These are statistic comparisons from Ohio to Summit County, obviously to Akron. And this was created from the Eviction Lab. So Ohio experienced 57,980 evictions in 2016 alone, which equaled a rate of 3.49, which is 33% higher than the national average at that time. Summit County by itself experienced 3,288 evictions, and the city of Akron experienced 2,492 evictions. So the city of Akron's eviction rate was higher than the Summit County as a whole eviction rate. Race in the above chart is the percentage within Summit County. We just want that to be noted. So with that being said, we're really doing a deeper dive into what we're seeing in terms of race. And we are seeing that our African-American population, especially single moms, are disproportionately affected by evictions rather than any other race or marital status in our community. Next slide, please. So we did a community assessment with our Ohio Equity Institute partners, and we did a survey, as well as we have a couple other programs in our community that does ask some questions around housing. And we also have some information on this slide directly from our Akron municipal courts. And within that process, we can see how many evictions were filed. So you can see that graph on the right-hand side. But according to our survey assessment that we did in 2019, housing came up as one of the most pressing issues in our community. And within our navigator data, which are community health workers, certified community health workers that are in our community that are screening pregnant women as they come in, that are asking for resources and varying services and programs in our community, that 60% of them indicated that they had some type of housing instability. Now that does not mean that they were absolutely homeless, but we qualify housing instability as them indicating that they do not know from a day-to-day basis where they're going to lay their head at night. So that was extremely concerning to us. So ever since we started the Navigator program, which was in 2018, housing has been at the very top of our list. We have been making sure that we have been working with grassroots agencies as well as some of our local funders to develop transitional housing and other varying ways to house women, as well as some of the future things that I'm going to talk about in a second. Next slide, please. So as far as our partnership, we've really been looking for trends in the data. We're also really trying to get community committees involved in the work. And more importantly, we're just trying to be patient. And we understand that change does not happen overnight. And challenges and lessons learned, just being proactive, listening to our families. I think one of the biggest things that we've learned is we have to involve the families in the conversation. And also in making sure that community partners and decisions are being made amongst the community and going to the community rather than just making them in our offices. Next slide. So what's next for Summit County? We've implemented some of these things, and some of these things are in the making. So screening and referring through our United Way 2-on-1 system. We have hired a housing coordinator through United Way 2-on-1 with some of our funding, and that is the key point for housing when we're trying to get someone housed. As far as a pilot, we're piloting with AMHA the priority for pregnant women. That's really great, and we're really excited for that. Those preference points, that's really going to allow us to enhance to get individuals to the top of the list. We've been developing, and we're extending our development of workforce development and financial training for women in our community, and trying to get them directly set up with economic opportunities in varying jobs. And as far as inviting community to the table, we are actually doing small stipends for individuals who are participating in work groups and sitting on boards. We're really encouraging our partners to have at least one person who they currently serve on their board so they can get that real authentic representation when they're making those decisions. Also, we recently were accepted into a pilot program similar to what Celebrate One is getting ready to talk about. So we're really excited. We think that housing is a great opportunity, and we have so much room for growth in our community. And as you can see from the numbers, we definitely have some need. Thank you.
Fantastic. Thank you for that wonderful presentation there. We will turn it over to our friends in Columbus. Let me go ahead and share the presentation for us all. Okay, can you all see my screen? Great, take it away.
Sonia is going to kick us off. If you want to go to the next slide, please, Camille. Thank you.
I almost started without being off of mute. Good afternoon, everyone. Thank you for the opportunity for allowing us to present and share. As we get started, I wanted to introduce you to Kayla. So Kayla is a 34-year-old, Kayla is 34 years old and a pregnant mother of 5, although she has had 10 pregnancies. Of her previous pregnancies, she's had 6 births, which were all premature, with one child later being lost in a sleep-related incident before her first birthday. Kayla's health history includes being diagnosed with asthma, bipolar, and depression. Kayla has served 4 years in prison and has an eviction on her record. Kayla has fierce determination and strength, but her criminal record history, eviction record, and need for a large unit to accommodate her family all serve as barriers to obtaining housing on her own. She enters Healthy Beginnings at home through her own resiliency with goals of having a healthy baby and safe, decent, affordable housing for herself and her family. Through the support of the Healthy Beginnings at Home program and Kayla's own determination, she gave birth to a beautiful, healthy baby girl who recently celebrated her first birthday. This was her first child born full term and at a healthy weight. Kayla was able to bring her daughter home to a safe and loving environment with the rest of her children. We will hear more about Kayla later, But now I'll turn it over to Priyam, who'll share more about Celebrate One.
Next slide. Thanks so much, Sonia. I think that narrative is so powerful and truly reflects a lot of the moms that have participated in the Healthy Beings at Home program. So good afternoon, everyone. My name is Priyam Khan, and I serve as the Director of Community and Legislative Strategies for Celebrate One, largely addressing the social determinants of health that impact infant mortality. Next slide. The Celebrate One is a community-wide collective impact initiative with the mission of decreasing Columbus's infant mortality rate and closing the racial disparity gap. I do want to take a second to acknowledge our Executive Director, Maureen Stapleton, who is in the session today. And Maureen, I don't know if you want to say anything, but I know you can help us answer some questions at the end. So recognizing that housing is an important social determinant of health, I think Jessica put this in context, and as well as the Akron team, Celebrate One convened partners to establish the Healthy Beginnings at Home program in 2018. So we did this with many partners, two who you see on the webinar today, because we know that housing is a critical social determinant of health that impacts infant mortality. So I think this slide is an important one. So why tackle housing to improve maternal, birth, or child outcomes? Safe and stable housing is widely regarded as a key social determinant of health impacting perinatal health outcomes. Housing instability is a major risk factor for preterm birth and low birth weight, on par with risk factors such as maternal diabetes and hypertension. Research findings show that housing instability or a shelter stay during pregnancy increases a woman's risk of having a premature birth by 200%. Although research has demonstrated the impact of being unstably housed on birth outcomes, housing has not been the target of many public health interventions focused on reducing infant mortality. Additionally, we know this is an issue of racial equity. Black Ohioans are only 13% of the state's residents, but make up nearly 50% of its homeless population. And COVID-19 has exposed underlying racial disparities in health and housing. Next slide, please. So Healthy Beings at Home is a community initiative striving to reduce infant mortality through an affordable housing intervention. The partners you see here helped Celebrate One with HBH, and I'll just refer to Healthy Beings at Home as HBH, implementation, funding, and research support. I want to acknowledge Sonia and her team at CMHA who administered rental assistance and provided vouchers to our program participants, and Amy from CareSource, who provided funding and care coordination through nurse case managers and life coaching services for our HBH families. Next slide, please. So, sorry, we'll go to the previous slide just so I can give a little more context. HBH emerged as policymakers across the state of Ohio were grappling with alarming rates of infant mortality for Black families. So it was a growing consensus that SDOH played in the impact of infant mortality, and state policymakers with the legislature and administration began questioning the role that the lack of affordable housing was playing. So the Ohio Housing Finance Agency stepped forward to competitively award funding to research the role that housing might play to improve birth outcomes. Healthy Beings at Home was established as a collaborative to undertake this research, which is intended to further inform the policy debate. Next slide, please. So this study, HBH, consisted of 100 women who were randomly assigned to receive either the housing intervention or usual care. The enrollment criteria was the following that you see here. Pregnant adult in their first or second trimester, must be living in Franklin County, household income less than 30% AMI, enrolled in CareSource, and experiencing housing instability or homelessness. The housing intervention group received rental subsidies and housing stabilization services. Next slide, please. So we define housing instability as a family experiencing multiple moves, eviction or risk of eviction, overcrowded or doubled up, a severe housing problem, and homeless, or living in a shelter not fit for human habitation. Next slide. The rental assistance was for 15 months of rental subsidy, followed by 6 months of step down. I think what was unexpected and pretty incredible about our rental assistance component was that Healthy Beings at Home was able to secure 27 vouchers for our program participants. And that was due to the generosity of CMHA as well as Community Properties of Ohio, 2 key housing partners in our community. Next slide, please. The housing stabilization services included identification of housing, negotiation with the landlord, and help with any challenges for the participant to remain securely housed. We were intentional to use a CTI model, critical time intervention, and housing first approach. Additionally, the housing stabilization specialists use best practices such as person-centered planning, motivational interviewing, and trauma-informed care. Lastly, the women who participate in the housing intervention group also receive services offered to the usual care group, such as Celebrate One community health worker, a CareSource case manager, and a Job Connect coach via CareSource. Next slide. So participants were randomized in the usual care group and received the services I just mentioned, but no housing subsidy. Next slide. Here's a quote from a Healthy Beginnings at Home participant who described her experience. So I never got this much support and help before. Having your first baby, you don't know what to expect. They were there to support me and ask me about my baby, ask me if I needed transportation and all that stuff. And I think it really goes to show some of the underlying barriers to get to prenatal care. So, we're talking about housing today, but we also saw some additional ones such as transportation or lack of transportation. And now I will go ahead and pass it to my colleague, Amy Riegel, to talk about findings and research and evaluation.
Thanks, Priyam. Yes. So hello, and I wanted to take a quick minute just to put a little context around who CareSource is. So CareSource is a managed care organization that operates across 5 states, including Ohio. We're a nonprofit health insurance plan that provides health insurance for individuals who are on government-sponsored health care. So we only serve Medicaid members and then individuals who are receiving health care through the marketplace or the exchange and Medicare Advantage. So as a plan, we knew that we've had a lot of intersection through our whole history between those who live in the units owned by CMHA and also those who are most at risk within communities for health disparities and poor health outcomes. So we were happy to join this initiative and be a supporter in a multitude of ways for Healthy Beginnings at Home. And so next slide, please. As we go through the findings, this was a very robust research and evaluation, and so we looked at it from a multitude of lenses. Nationwide Children's Hospital was the primary investigator, and so they did the research study components that were formalized, and they were kind of the core of the research that was done. And Nationwide Children's Hospital's work was led by Dr. Kelly Kelleher and his team, and they have provided great support and guidance throughout this process. We also worked with the University of Delaware at the Biden School of Public Policy, and they did a housing assessment at the beginning, midterm, and now are completing the final assessment of housing stability for the women. And then the Health Policy Institute of Ohio provided a policy evaluation, or I'm sorry, a process evaluation that really looked at every aspect of the program and has helped us to create a framework of how we can replicate this program. And then CareSource was able to do research also looking at health outcomes, but in a slightly different angle and looking at the cost and utilization of those who participated in the program and using this information to report back to the Ohio Department of Medicaid to show how a program with a primary intervention of housing can also help states save Medicaid dollars. Next slide, please. And so the question was, as we look at this, Priam stated earlier that there's a lot of research out there that shows that if you don't have stable housing, that there are negative health impacts. But there is actually a gap in the literature about what happens if a person does have stable housing and how does that improve, or does it improve, birth outcomes. And so we really went to focus on that question and to see if by providing housing, if we could help improve birth outcomes and therefore reduce infant mortality. So Nationwide Children's Hospital not only looked at data that was provided through the medical claims and other quantitative information that was collected, but also completed surveys with the women at 6, 12, at 18, and 22 months, along with a very rigorous assessment that was done at the beginning when the women enrolled in the program. So there was a significant amount of information that was collected, not only through data sources that were collected, but through the women's verbal account of their situations also. Next slide, please. And so as we looked at the demographics, the intervention group was very similar to the control group, and their characteristics would have predicted similar outcomes between the two. And you will see that 81% of the women did identify as Black, and that is more in line with the homeless population, but is a disparity and is not necessarily, and the homeless population is not representative of the population of Columbus and Franklin County. The average age of the women was 25, and 81% reported a prior pregnancy. The interesting fact about this is only 64 of the women reported having children within the home, and that number can indicate for many of the women that they had had a pregnancy that either ended in pregnancy or infant loss. Next slide, please. We also knew that even had we had the housing units available for the women and housing rental assistance, that wasn't enough. It's really important that we emphasize that one of these factors that was a part of this model would not probably have been enough to help the women really find stable housing and maintain that stable housing. Many had past evictions, criminal records. Utility arrearage was a huge contributing factor to the women's ability to find stable housing at the time of enrollment. And so the housing support specialists at enrollment and then throughout the entire duration that the women were in the program stayed with them and helped them address these issues and maintain their stable housing through the additional removal of barriers over the period of the study. Next slide, please. And the women also were very low income. There are still impacts of this after the study has concluded, partially due to COVID at the end of the study, and that many of the women are still not stably in employment and able to carry the rent on their own. So many of them have had to continue to receive or seek resources to help them remain stably housed and have rental assistance. This is another reason why it is incredibly important that we received the 27, or that 27 of the women were able to be in voucher units during the program. Next slide, please. And most of the women had reported that they had experienced homelessness sometime in their life, and many of them had been homeless within the last 6 months prior to entering the program. Next slide, please. So as we start to look at birth outcomes, our researcher, Dr. Keller, who I mentioned earlier, would tell me I have to say that these are not statistically significant. However, the study was never sized large enough to prove statistical significance. And so that's part of our goals with replication. But you'll see here in sheer numbers that within the intervention group, we had no infant losses and no children were lost before their first birthday. However, within the control group, we did experience four fetal losses during pregnancy. And if you look at the number of full-term and healthy birth weight, the intervention group had 40 of the babies born full-term and healthy birth weight, whereas only 24 from the intervention group had that same experience. So we definitely saw a difference in the sheer numbers of babies that were born full-term and healthy birth weight. And so next slide, please. When you look at the fact of prematurity and low birth weight, the number one difference that we saw clinically between the intervention group and the control group is that the intervention group was 60% less likely to need NICU intervention. And so that's the neonatal intensive care unit. And we looked at that from any baby who needed any amount of time in the NICU. For the babies that did need NICU utilization, the intervention group, their length of stay was 75% shorter, with an average length of stay of 8 days compared to 29 days. And part of that was that the doctors and the staff knew that the woman in the intervention group had a safe place to go home to, that she had somewhere stable where she could help the baby get the treatments that they needed. Home visiting nurses could come, other types of in-home health care could come to her home and help care for the baby. Whereas the women who are unstably housed didn't have that option. And so as we look at overall health and well-being of the women in their mental state, in their physical state, and of the babies too, what we see is that the housing really made a difference in them being able to have the best health outcomes possible. So now I'll pass it back to Priyam, who will talk a little bit about the process evaluation.
Thank you, Amy. So go to the next slide. Thank you. As Amy mentioned, we partnered with HPIO, Health Policy Institute of Ohio, to conduct a process evaluation. So as far as we know, this is a one-of-a-kind study integrating health and housing, and a unique model from anything we have seen across the country. And so we wanted to capture our learnings comprehensively and for potential replication, which we now know communities across Ohio are seeking to do, including our friends in Akron. Next slide. So here are our findings at a glance. It's no surprise we were impacted by COVID. In this regard, we saw program participants lose jobs, have difficulty and barriers with childcare. And I think to pull off a study like Healthy Beings at Home, it truly takes cross collaboration to make it work and to better serve our families. So I would say even through the thick of COVID, we didn't lose any program participants. All women are still currently housed, and it's really truly due to the community investment in this program. Next slide, please. Let's see, additionally, the resilient participants formed strong relationships with the housing stability specialist. And these were essentially case managers employed with the Homeless Families Foundation, which was our housing stabilization partner, and really formed really close relationships with the women that they served. These program participants had hope for the future and were engaged with HBH services and activities. The role of the housing stabilization specialist was critical. They were case managers, as I mentioned. They were respectful and empowering with their approach. They were a one-stop shop for resources and help participants with landlord negotiation and navigate the housing market, which can be a really hairy situation for anyone, despite their circumstance, but especially in this one, which is more vulnerable. Next slide. And I would say out of the, this slide is powerful because rental assistance is necessary, but it's not sufficient. And just to give you kind of a high level of where the women kind of ended up in terms of their housing, out of the 49 participants in the housing intervention group, 22 families were in privately owned units. And I will mention, so these were the families and the women that were subject to step down in rental assistance. So after a period of time through the step down process, they would start making their rental payments each month until they get to that full market rent. I will mention that the families with CMHA housing are still supported by CMHA staff and services, and they receive those services as they transition out. That the same goes for the families who are still supported by our housing stabilization partner, Homeless Families Foundation. So again, kudos to our community partners, truly stepping in and making sure the families are okay and supported through the step down process and beyond. 24 families received project-based vouchers. So these were through our housing partners that I mentioned before. And then 3 families had long-term portable vouchers with private units. So we learned that rental assistance, as I mentioned, is necessary but not sufficient. As the challenges listed here on this slide convey, time to house took a long time due to the lack of affordable housing I think we experienced nationwide, but certainly in Ohio and across Franklin County. And many participants had utility arrears, as Amy mentioned, that we helped solve for, and that were frequent moves. And there were frequent moves among this population, as you might imagine. And so next slide, please. And the next 2 slides really cover our policy recommendations. I won't go in depth here. The preliminary findings of HBAH have policy implications for our local, state, and federal elected officials and policymakers in the healthcare systems, managed care organizations, maternal child health services, and housing providers. You can find this brief in our Celebrate One website, along with the process evaluation, if you are interested in replicating a model such as this one. And of course, the 3 of us are welcome to help you with that conversation if needed. But I will go ahead and pass it to Sonia to wrap us up.
This program is transforming lives, like Kayla's, who was accepted into and completed the Ohio State University College of Nursing Certified Community Health Worker program. She persevered through family struggles, illness, and the business of everyday life in the midst of a major worldwide pandemic to complete the program. Through the advice of her case manager, Kayla applied for and obtained a subsidized housing unit out of county, which will allow her to live affordably in a unit that fits her large family's need at a rent that she can afford. Healthy Beginnings at Home will continue to support Kayla after she moves in order for her to transition, acclimate, and shine elsewhere. Kayla is a true success story. Her strength, patience, consistency, and self-reflection, combined with the platform of support from Healthy Beginnings at Home, has positioned her and her family for continued success in health, housing, and life. Thank you again for allowing us this opportunity to share, and we'll open it up for any questions.
Fantastic. Thank you so much for sharing with us today. Give me just 1 second as I transition out of the PowerPoint. So thank you again, everyone. We are moving into our Q&A portion, and we had a question in our chat that I'm going to kick us off with. Give me 1 second. Can you please all share how many staff members work on these programs at the PHA and partner organizations relative to the number of women served? Thank you for your amazing work and presentations. We're slow to this work, but are getting ready to start an aligned project in New York City based in the Housing Authority soon.
That's cool. I'll share from a CMHA perspective of how many people from our team, because you never know how many people need to get involved until you start getting into it. So we had higher level support and involvement at a COO level. That was definitely needed to keep things moving. We had our vice president of the Housing Choice Voucher Program that was there to make sure that participated more in the meetings to make sure to approve the different offerings, as well as utilizing staff and CMHA resources to process the rental assistance. So that also included a manager that is now an AVP level position, and our as well as additional individuals for processing the rental assistance. And then we have the Resident Initiatives Department that provides support not only, so from my perspective, so with me, so to provide the support when, for additional supports, as well as the partnership opportunity to determine how we can replicate some of this work for individuals that are pregnant that are living in our housing. And then property management. So Amy and Priam mentioned earlier that some of the residents, some of the program participants live in our housing communities. So it's getting property management involved and letting them know up to date. So that's 6 people within the housing authority to help make this work for the program, for our program participants. That's just within CMHA.
And those were involved, or were they full-time on this program?
Not full-time.
But involved. Great.
But involved.
I can talk about Akron. At AMHA, the core early childhood initiative work is mostly done by 5 of our parents as teachers, child and family partners. They've got the hard job. They're out there working with our families. On average, they're serving about 25 families per year in parents as teachers, and they have other responsibilities also. They do general home visitation. But along with those 5 home visitors, there's myself, the supervisor, and we also have a program coordinator. So a total of 7 doing the direct work, along with the support of our director and AMHA as a whole, who supports us in kind.
Thank you. You know, that leads to one of the questions I had. I know Akron's doing a little bit more on scale, but particularly for our Columbus team, how do you see about scaling up this program from what you all have done in this pilot research study to maybe have a wider reach?
This is Maureen Stapleton. Priam introduced me earlier. I did not want to take any time so that they could get through their presentations. And thank you very much, Sonia, Amy, and Priam for doing a fabulous job explaining what we were able to accomplish through Healthy Beginnings at Home. We see housing as a major linchpin in providing the services and care for our moms. And so we're actually looking at this as a multi-pronged approach. First, it's pure replication, finding dollars either from our philanthropic community or federal assistance to actually replicate what we have done, as Amy said, to make sure we get more than 100 people in the next time. And that's what I understand a number of cities are joining us in this effort of trying to begin that replication piece. But we're also doing a variety of other things related to ensuring that pregnant, homeless, and pregnant, imminently homeless women never get into shelter in the first place, that they're immediately taken through a path system that we're creating from that circumstance into housing, and then wrapping a variety of home visiting and other services around them. So that's kind of what I call HBAH light. It's not a pure replication, but it is one of the linchpins, again, providing our vulnerable population access to housing so they never become homeless. So we're working through the process with a variety of partners now, trying to make sure the path, we understand the process and how we catch moms wherever they are and families wherever they are and get them into suitable and stable housing. Because again, we've already proven that suitable and favorable and appropriate housing helps in birth outcomes. So however we can take a component or piece of this and begin to replicate it, we will do that. So pure, light, and any other components that we can pull and glean from what we've learned from Healthy Beginnings 2.0. So we're doing a variety of things.
And Amy, if you wanted to chime in, because we were able to, I think the Akron and other Ohio cities are able to start the replication process due to a very generous grant recently provided by CareSource. But I'll let Amy share.
Yes, so we at this point in time are hopeful that there will be additional funding through the Ohio state budget. And so we have started a replication planning grant process with 5 cities across Ohio. We're also looking to engage cities in other states. So this is an effort that we really do believe is showing great success and is trending in the direction that we were hoping for. And the only way that we continue to prove the results and outcomes is by scaling it to more and more cities and locations. We see great programs get stuck in the place-based phase all the time, and replication and scale is often the biggest hurdle that they have to overcome. Housing authorities are one of our greatest partners, and they, as we talk to every city, we say, so where's your housing authority? Are they participating with you? Because if they're not, we've got big problems. And so the housing authority can be the lead. So if there are housing authorities out there who are interested in replicating and starting this conversation in your community, please reach out, because we would love to talk to you and help provide the guidance to get you started.
Fantastic. I have a question particularly for our Akron friends. Shalita, you mentioned that racism and implicit bias are one of the priority areas of 2021. I wanted to know how you all are taking explicit action on that. Is it a part of the larger programs, or are there specific steps around that goal?
So we are taking a multi-pronged approach. We're being very intentional to evaluate our programming, our policies, and the work that's being done as a collaborative to make sure that we're being very culturally competent and culturally sensitive within our work, as well as addressing any concerns that have came up in the past that may have been negated. Also, public health. Racism has been recently deemed as a public health crisis in our community, both at the county level as well as at the city level. And our city and county are taking different approaches, but we're being very adamant in participating in those approaches and making sure that maternal child health is at the forefront of those conversations. We understand that our children are our future, and that currently, unfortunately, where you live is a huge representation of your overall lifestyle and your overall health outcomes. So we're just really being adamant not to let the conversation go. We're really being forceful in the conversation, making sure that we're inserting the comments on, okay, well, how is racism being taken into consideration? How are we looking at policies and what things have been developed because of 400 plus years of oppression and all the things that have happened in the past, and how we're not going back to look at what we've done unintentionally to build these policies that have hurt our community. So just kind of like how Jessica said, we're bringing up a redlining conversation often, like almost every time we get a chance, we talk about redlining and how it affects overall health. So just really making sure that we're being intentional in the conversation, not being scared to have those conversations, and making sure that the community is a part, because at the end of the day, if we don't have the community's voice at the table, then we're not going to truly impact the community that we're trying to serve.
Definitely. So that brings me to an additional question, which is to dig in a little bit more into the community engagement aspects. Also, I heard in the example, Kayla was becoming a community health worker. Did you all engage community health workers at all in these initiatives?
Yes, for the Columbus team. So we had initially 2 and then eventually 1 full-time health worker who was dedicated to the healthy beings at home moms. So helping to make connections and resources throughout our community, helping with some of those S2H barriers. And then we also had a wonderful team at CareSource, which I'll let Amy talk about.
Yes, we use community health workers as part of our outreach to all of our members, but we did connect. And so I think that community health workers are becoming a key tool to helping to reach individuals. But I do have to emphasize that making sure that you're not overburdening the individual who's participating in the program. So we were very quick to understand that our women were oftentimes identifying more closely with the housing support specialist or with the community health worker or with their life coach, and not necessarily their care manager who was like, let's talk about your blood pressure at your last visit. And that's okay. If the connection is with another community partner, we did case conferencing. We made sure that we kind of were all keeping a good eye on how the members were doing. But if they can make that relationship, value the relationship and respect the relationship, and I think that was key to our success.
Great. And Akron, have you all been incorporating community engagement or community health workers at all in your work? Can you talk a little bit about how you've incorporated them?
The Housing Authority, we really haven't up until recently. We have 2 on board now in for our Jobs Plus program, but they're just getting started.
Throughout the collaborative, we have community health workers integrated into various programming, as well as serving, as I indicated before, at the navigator capacity, which is truly just navigating women as they are identifying that they're pregnant and that they need resources in the community. Also, we have been integral in assisting with getting not maybe necessarily community health workers, but social workers or licensed individuals in roles to help aid in resource finding and things of that nature. I think it's really just important to make sure that there's that connection, no matter what profession or certification the individual may have. Just being able to connect on that personal level really drives home, especially when dealing with varying populations and different struggles that people are going with. So just keeping that has been really successful for us. And our community health worker, unfortunately right now we need more. So we're really trying to figure out ways to get more people certified and employed and things of that nature, because it just seems like there's never enough, which is great, but just trying to navigate that.
Thank you. So this brings us to time. I really appreciate you all's time today presenting with us. I think we all can certainly agree that healthy starts are the first step to thriving and healthy futures. So I'm so excited to hear about these projects really addressing that for our communities and keeping a particular eye on addressing it for all parts of our communities. I believe there was a couple of resources added in the chat, so feel free to take a look at that before we close out. Otherwise, thank you all again. We have a survey for each day of the conference. This is available in our conference app, which you can find more information on the Summit webpage. We'd love to get reviews back from everybody to hear what you all enjoyed or how you would like things to change for next year. We hope next year we'll be able to be at least partially in person. So please keep a lookout and join us then. And feel free to reach out to the HousingIs team if you have any questions or ideas in the future that you want to chat with us about. Thank you again. I'm wishing you all a healthy spring and summer coming up.